Today I'm going to be talking about cognitive behavioral therapy, what it is, and what it looks like. Hi everyone. Today I'm going to be talking about cognitive behavioral therapy, or CBT, what it looks like and what to expect of this very popular and very common form of therapy. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in British Columbia, Canada, and this video is for informational purposes only. It is not intended as a replacement or substitute for advice from your doctor or mental health professional. Now, if you're finding my videos helpful and would like to see more, please hit that subscribe button and notification bell, and you'll be notified every Thursday when I post a new video. Now, with all of those things out of the way, let's talk about cognitive behavioral therapy. Now, CBT is a very widespread and popular form of therapy these days for one very good reason, and that's because it works. There is a lot of research and evidence to support CBT as sort of the gold standard or the most effective form of treatment for a variety of conditions, including things like depression, anxiety, PTSD, those types of things. And so a lot of people may have heard of CBT, but don't really have a good understanding of what CBT is, what it looks like, or what to expect if you were to pursue CBT with a therapist or a psychologist. And so what I want to talk about today is what CBT looks like and some of the principles of cognitive behavioral therapy. Now, the first thing to understand about cognitive behavioral therapy is that it focuses on the interrelationships between behaviors, thoughts, and emotions. What you do, how you think, and how you feel. Now, most of the time when people come to see me, they're having problems with emotion. I feel really down. I feel really anxious. The problem is there's no direct way of changing that. There's no direct way of controlling how you feel. So for example, it wouldn't be particularly helpful if a client came into my office one day and said, I'm feeling really down and I'm feeling really depressed. And if my advice were to be, okay, what I hear then is that you're probably experiencing depression, so what you need to do is just cheer up, right? That probably isn't going to be all that helpful or beneficial to the person because we don't have direct control over how we feel. And that's a key point. It's not like we can just hit a button and just feel a different emotion. These emotions are out of our direct control. But to some extent, we have control over our behavior. So for example, if I said, I want you to stand up and walk around the room for 5 minutes, you could probably do that. We also, to some extent, have control over how we think. So if I said, I want you to try and think about a situation differently for 5 or 10 minutes. Now, you may find that a little bit challenging, but you do, to some extent, have control over that. And certainly more control over behaviors and thoughts than you have directly over your emotion. And so what cognitive behavioral therapy does is it focuses on behavior change and thought change to indirectly get at changing the emotion and indirectly get at helping you feel less depressed and helping you feel less anxious. So the key idea of cognitive behavioral therapy is that it helps you develop a new understanding of your problem. So for a lot of people who are having anxiety or depression, it feels like they just don't understand why they feel the way they feel and why they can't shake it. And so CBT really focuses, especially early on helping a person develop a new understanding of what's going on, helping them develop an understanding of anxiety and depression that they may not have ever known before. And so when we're doing CBT, we work a lot and we focus a lot on models to understand what's going on. Because a lot of times it can feel like this doesn't make any sense. It doesn't make any sense why I'm feeling so depressed. It doesn't make any sense why I'm feeling so anxious. But if you can understand models of depression, models of anxiety, it can help you better understand that it actually does make a lot of sense. And it makes a lot of sense to understand the mechanism behind these conditions. So CBT is really about developing a new understanding and a new model of why you're experiencing the emotions that you're experiencing. Because from this model, we're going to talk about skills. So the skills and the tools of CBT come directly from this new understanding of depression, this new understanding of anxiety. So cognitive behavioral therapy is a very skills-based form of therapy. And what that means is that it's really about doing new things, so changing behavior and changing thinking patterns to get at improving emotion. So it's about learning and practicing skills. So cognitive behavioral therapy session is really about training. It's almost like a course in anxiety management, a course in depression management. And so the sessions tend to be very structured and planned. So rarely should you go into a cognitive behavioral therapist's office and the session starts with, okay, so what would you like to talk about today? In cognitive behavioral therapy, there should be a plan for each session and a plan for what it is that we're going to cover, what it is that we're going to talk about, because again, it's focused on developing skills. Now, one of the important results of this focus on skills in cognitive behavioral therapy is that homework is a critical component of CBT. So if you're not being assigned homework, if you're not doing homework between therapy sessions, you're probably not doing CBT. Because I liken CBT a lot to something like piano lessons. So imagine you're taking piano lessons and you sit down with your piano teacher once a week and you learn to play a piece of music. What happens if you don't practice at all between those piano lessons? Well, you probably don't learn very much about playing piano. So it's not the hour that you spend with the piano teacher where you're really learning how to play piano. It's in the practice that you're putting in between piano lessons where you're really learning how to play the piano. It's the same with cognitive behavioral therapy. Just coming into my office and talking to me once a week for an hour probably isn't going to be all that beneficial. But what will be beneficial is that we'll talk about skills and tools. You'll be assigned homework. You work on the homework between the sessions. And when you come back the next session, we review the homework, see what you learned doing it, troubleshoot any problems, and then talk about a new skill and assign new homework. So that's what I meant by CBT is a very structured form of therapy. It's really about a plan moving forward, and every session builds on the next to help a person move forward. Because the ultimate goal of cognitive behavioral therapy is for the client to become their own therapist. The idea is that at the end of the therapy sessions, the formal end of therapy, it's not that a client has mastered all of the skills and all of the tools or that they're feeling 100%, but the idea is that you've learned all of the tools and skills that you need to manage your anxiety and manage your depression moving forward. So I know that I've been successful in therapy with my clients if by the end of the therapy sessions, they don't need me anymore. That's the goal, is that the client becomes their own therapist. They know the skills, they know the tools that they need to use, they've been practicing those tools, and they know what they need to do moving forward. So that I really like about CBT is that it really gives a person a sense of control and autonomy. That They know what they need to do. They understand their depression. They understand their anxiety better, and that they know exactly what they need to do to manage their anxiety and depression moving forward. Another unique component of cognitive behavioral therapy, and it differs, this is something that differs from a lot of other types of therapies, is that cognitive behavioral therapy really focuses on the here and now. It's really focused on what's going on in the present. When we're doing CBT, we don't spend a lot of time going into the past and going into sort of childhood experiences that might have contributed to the person's anxiety and depression. Because, for example, if I could tell a person the reason why you're feeling anxious now is because when you were 5 years old, you were stung by a bumblebee. And there was this weird neurochemical reaction that took place, and that resulted in you experiencing anxiety later in life. Well, even if that were true, you can't go back in time and get unstung by the bumblebee. So that doesn't really help. So from my perspective as a psychologist, the goal isn't to come up with some sort of regression equation to figure out all of the various components that have contributed to somebody's depression or anxiety when they're in my office. The goal is to focus on what are the factors that are maintaining the anxiety and the depression. What's going on in the person's life right now that's contributing to their psychological distress? Because that's what we have control over. We can control and we can change some of the things that are going on now. We can't change the things that have happened in the past. So CBT is very much focused on the here and now, focused on making changes in the present. And finally, CBT tends to be time limited. So I talked about it being a very structured form of therapy with a goal and a direction and a plan. The idea isn't that you see somebody for CBT indefinitely. So usually it's anywhere from 8 to 20 sessions. Obviously this can differ depending on the complexity of the case and the number of different types of conditions or the types of difficulties and the severity of difficulties that a person's having. But the idea is CBT tends to be time limited. It's not an ongoing form of therapy where you see your therapist indefinitely because you need their advice. Like I said, the goal is for you to become your own therapist, for you to understand your anxiety and depression in a new way and have a toolkit of skills and knowledge that you can use to manage your anxiety, depression, psychological condition moving forward. So I find CBT to be an extremely useful and effective form of therapy, and pretty much everything I do with my clients focuses on CBT, and all of the videos that I've been presenting and talking about, they're all based in cognitive behavioral therapy techniques. So I'm a real big advocate of it. Now, it's not for everybody. One of the questions I'll often have clients ask is, well, how effective is this? How likely is it that I'm going to see some improvement in my condition if I do CBT? Well, the answer is, it depends. So one of the nice things about CBT is that if the client puts in a lot of work and a lot of effort and does the homework, chances are they're going to see some significant improvements. However, the downside is the success of cognitive behavioral therapy depends on the amount of effort and work that a person's willing to put in. So if you don't do the homework, if you don't practice the skills, then you're probably not going to see a lot of benefit from CBT. And for a lot of people, they don't want kind of a structured form of therapy. They just want somebody to talk to. And that type of supportive therapy is fine. There's nothing wrong with that. It's just not the type of therapy that I do in terms of effective therapy for managing anxiety and depression. So I hope that's been helpful in terms of understanding cognitive behavioral therapy, to understand what it looks like. So if you're doing therapy with a psychologist or a therapist, and they're saying that you're doing cognitive behavioral therapy, but you're not getting any homework, you might want to ask your therapist, hey, where's the homework? I thought this was a skills-based form of therapy. But all it really feels like we're doing is just sort of talking about what's going on in my life. And like I said, there's nothing wrong with that if that's what you're looking for. If you're just looking for supportive therapy, somebody to talk to, a kind ear to sort of give you some feedback, that's fine. But if you're looking for skills and tools that are effective in terms of managing anxiety and depression, and want to get a sense of tools that you can use to move forward on your own, then cognitive behavioral therapy is probably what you're looking for. So I hope that's helpful. I would love to hear your thoughts and ideas about this, so please leave me some comments down below. So that's it for today. Thank you for making it all the way to the end of this video, and I will see you in the next one.